Do you ever feel tired for no reason? When it happened to this viewer one time too many, she reached out for some answers.
Hi doctors, I'm Kaish. I'm concerned because I feel tired all the time. Sometimes I go to bed late, I have to get up early. I know that people get tired from time to time, but I just can't seem to shake it. And I wanted to know, is this something that comes with aging or is it something more?
We often blame a lack of sleep, a hard day at work, or running around with the kids for our fatigue. However, feeling tired can be a warning sign that something is wrong with your health. Kaish joins us today, and I'm also joined by our good friend and colleague, Dr. Frida Lewis Hall, the Chief Medical Officer of Pfizer, who's here to help explain when being tired may be more than just being tired. Welcome to you both.
You know, Kaish, there is a long list of things that can make us feel tired and fatigued. Lack of sleep, poor quality sleep, poor eating habits, too little physical activity, too much physical activity, and of course, jet lag. But chronic fatigue is something else. It can be an important warning sign for an underlying health issue.
It also could be related to one of these three things right here. And we're gonna start with sugar, not talking about the kind you eat. We're talking about blood glucose or blood sugar. Fatigue is common, but often an ignored symptom in people with type 2 diabetes.
So in this chronic disease, the use of glucose up by your body is affected. You can actually experience fatigue if your blood sugar is high because it affects your circulation, amongst other things, or you can feel fatigued if your blood sugar is low because that means that the cells in your brain and your body are not getting enough fuel to do their jobs properly.
And it's important that people with type 2 diabetes know the symptoms. They may urinate frequently, feel thirsty, have visual problems, cuts that are slow to heal, or even pain or numbness in the hands or feet. And Kaish, here's the big thing. If you're not really sure what's going on, then obviously getting tested is important.
I was feeling lightheaded, and so I had some blood work done. And the doctor told me that I'm actually borderline anemic.
Anemia is caused when your body doesn't have enough healthy red blood cells to carry adequate oxygen to your organs. Now, you mentioned lightheadedness. That's a symptom, but the most common symptom of anemia is you have it, fatigue. Now, there are a number of different types of anemia. Some of them are caused by things like iron and vitamin deficiency, but there are other causes like chronic diseases.
I don't eat a lot of meat, and you mentioned vitamin deficiency. Could my diet maybe play a role?
And you know, it's a really important question, and for people at home as well, because your body does get iron from foods, things like meat, eggs, leafy green vegetables. If you consume too little iron over time, your body can become iron deficient. And anemia is also common in women of reproductive age due to menstruation, but it can be a symptom of a more serious underlying health problem and should certainly be checked out.
And you mentioned that anemia is common in women. It's also common in children, older adults, and people with chronic diseases.
And I want to move on to our last reason why someone may be feeling fatigue, and it has to do with this little guy, your heart. Coronary artery disease, a weakened heart muscle, or damaged heart valves can cause fatigue, and here's why. The heart and valves pump blood from your heart to the rest of your body all day, every day. If the heart is weakened, its ability to pump blood can be reduced. Less blood flow to organs, muscles, and then fatigue can certainly ensue.
So if you're feeling chronic fatigue, it's really important to schedule a visit to your doctor. Take to your doctor your medical history, including your family history, along with a journal of your fatigue. So you want to track your energy level on normal days and after activities and meals. Monitor the changes and make sure to note other symptoms that you might be experiencing as well. This may help you and your healthcare team figure out your fatigue and to come up with a good treatment plan. Now, there's a lot to learn about these various diseases, and if you want to know more, you can go to gethealthystayhealthy.com. There we have information on these conditions, their symptoms, risk factors, and ways to help manage them. And while you're there, you can sign up for the monthly newsletter.
Dr. Frida, thank you. Kaish, all the best to you, and thanks for sharing with us. We really appreciate it.
Thank you very much.
More to come, everyone.